Saskatchewan Cowboy Superstar Bowl. That's right.
Rodeo is dangerous. Sunday's competition in Merritt, BC had paramedics on standby. But there was no nearby emergency room available, not enough doctors. So if anything happened, patients would need to be transferred at least 45 minutes away.
That puts, I think, people's lives in serious jeopardy. This is one of the weekends of all weekends that this emergency room should have been open at any cost.
The mayor of Merritt says the ER has closed a dozen times this year. It's one of 5 hospitals in BC's interior with closures this long weekend because of staff shortages. Emergency rooms are on the front line of the opioid and mental health crises and often the only option for people who don't have a family doctor.
Why are we seeing the closures? Again, it's simply a supply and demand situation, and that is there are not enough of us.
The province says it's hiring doctors, training nurses, and buying ambulances.
No one's doing more than we are. No one's having more success than we are, and still there are closures, which shows you the challenge in filling, particularly in summer, 364, 24/7 in some smaller communities.
One issue? Working in a rural ER could be a hard sell for medical students.
I think that there's definitely some hesitations that we've felt about stepping into systems like that where we're not being totally supported by the entire delivery of healthcare.
Rural communities worry their hospitals could be closed for good.
The minute that we accept this as status quo, that this is the way it's going to be, our smaller hospitals will be closed down in a minute, and it'll be, yeah, you know what, you guys just drive to Kamloops.
This isn't just a BC problem. The Ontario Health Coalition says emergency rooms in that province closed 867 times last year, and other provinces have had to close ERs or reduce services when there isn't enough staff. Lindsay Duncombe, CBC News, Vancouver.